Hey, Tanya, how are you?
Hi, good, Tony. How are you?
Good. Are we in the right screen? Usually these guys are logged in by 1:45 before the meeting starts just to check audio and stuff. But
Hmm. Uh, you got the invite right from Jamie?
yeah, I got it this morning, and it may be fine, but I just wanted to make sure that we're in the right place.
Yeah, let's see. It's 12:52. Let me check my calendar. Hold on. Yeah, I'm checking with my coworker. So let's see what he says.
Okay. Hey, Mark.
Hey, Tony, how are you?
Good. Trying to figure out if we're in the right room.
Yeah, that's a good question.
I mean, they're usually on about 1:45, just checking audio and stuff, and I don't see any of those guys on here.
Yeah, I have 2 calendar invites, so hopefully we don't have the wrong one. Hold on, give me 1 minute.
Yep.
I think we're in the right room. Jamie just signed on. Hi, Jamie.
Yep. Hi there. Let me just double check
Good.
and make sure we don't have another link that went out, but it's a good sign that most people are, that there are some folks here.
Yeah.
Yeah, I was surprised you weren't already on, Jamie. Usually you're on testing audio and stuff, and it was just Tanya and I here for a minute.
Now that home base is doing the heavy lifting. Oh, good. And Leslie's here. Okay, good. I think folks are just taking their time today. Mark, I'll monitor my email to see if I get any messages from people that say they can't get in.
Sounds good. I'll keep my email open also.
Okay. Takes a village to get these off the ground.
Yeah, for sure. Jamie, quorum count, because you wait until, right, there's enough folks on for quorum.
Yeah.
Is it 7?
It is, I believe, 9.
9, okay.
Let me go back and check, but yeah, so I usually, as staff, I'm counting that and then letting Lindy know when we pick quorum.
Yeah.
So it's basically half plus 1. And I think right now we've got 60, so it's 9, yeah. We have 16 seats filled. So once we hit 9.
Got it. Okay.
This is the Council of Homelessness meeting.
Yes, it is. You're in the right place.
My bad.
No worries. We're just waiting for folks to arrive.
Good afternoon, Jamie. Good afternoon, everyone.
Lindy, home base will let you know when we hit quorum.
Sounds good. Thanks, home base.
You are very welcome. I believe we are at quorum. So go for it.
Wonderful. Thank you, Mark from Home Base. Welcome, everyone. My name is Lindy Johnson. I am the chair of the Council on Homelessness, and I am very glad that you are here joining us today. We are going to begin the meeting with introductions of our Council on Homelessness members, but we do ask that if you are here as a community member that you introduce yourself in the chat. Let us know your name and what organization you are here representing. We'd appreciate that we're using the Zoom platform today, which makes the chat a little easier. So please feel free to put any information that you might want to share in the chat as well. If you are calling in today, we do ask that you let us know so that you can introduce yourself via voice. That way we have a record of your attendance for the minutes. So again, if you're calling in, please, after we do introductions of the council members, unmute yourself and introduce yourself so that we have a record for the minutes. I also do at this time tend to ask everyone to be aware that at the end of our meeting, we tend to do community announcements. So while there is a public comment section, we ask that if you have a community announcement that you save that to the end and or put it in the chat as well. Okay, with that, we are going to jump into introductions. Is Iman Novin here? I heard someone unmute, thought that might be him. Margaret Schultz.
I'm Dr. Margaret Schultz. I'm the behavioral health chair for the Council on Homelessness, and I'm a psychologist and clinic program manager for the Hume Center's FSP program and outpatient program.
Thank you, Margaret. Terry House.
Hi, I'm Terry House with City of Antioch, CDBG and Affordable Housing Consultant, and I hold the city government chair.
Leslie Gleason.
Hello, this is Leslie Gleason. I'm the COC ESG grantee representative, and I serve as executive director with Trinity Center.
Thanks for being here. Joe Bruno.
Joe Bruno here, peer support specialist, currently the consumer seat on the council.
Thanks, Joe. Alejandro Chamberlain. Okay, we'll come back to Alejandra. Gabriel Lemus.
Hello, everyone. I'm Gabriel Lemus. I am the CDBG and ESG program manager for the county, and I hold the Emergency Solutions Grant program seat.
Thank you. Our vice chair, Lynn Peralta, who thankfully is going to take over for me a little bit later this meeting when I have to leave early.
Good afternoon, everyone. Thank you, Lindy. Lynn Peralta, I'm with Contra Costa County Employment and Human Services Department in the Policy and Planning Division, and I hold the EHSD representative seat.
Thanks, Lynn. Doug Leach.
Good afternoon, everyone. I'm Doug Leach. I am from the Multi-Faith Action Coalition, and I hold the Faith Community Representative seat on the council.
Thanks, Doug. Lene Altman. Deanne Perrin.
Good afternoon, Deanne Perrin, Executive Director at Hope Solutions, and I hold a homeless service provider seat. Happy to be here.
We're glad to have you here. Tony Yusufari.
Good afternoon, everyone. Tony Yusufari with the Housing Authority of Contra Costa County, and I hold the PHA seat on the council.
Thanks, Tony. Sean Ray.
Sean Ray, Lieutenant with the San Pablo Police Department, and I hold a public safety seat.
Thanks, Sean. Manjeet Sapal.
Hi, good afternoon, everyone. I'm Manjeet Sapal. I'm the chief of the Martinez Police Department, and I hold the other public safety seat chair.
Masaki Hirayama. Maureen Nelson.
Hi, I'm with the Workforce Development Board and I hold the workforce seat.
Juno Hedrick.
Hello, I am the youth representative and I am also a YAC member.
Thank you so much for being here. And again, I'm Lindy Johnson, and Leslie just messaged me. I got married 2 weeks ago, so that's why my last name has changed. So I appreciate those of you who noticed. I'm very excited. So we are good to move on. Thanks so much, Homebase. Okay, this is the public comment period. If you are a member of the public and would like to make comment or have a question or would like to just share something with us that does not relate to an item that's already on our agenda, this is the opportunity to do so. Please feel free to unmute yourself. You can also raise your hand if you're having any trouble unmuting yourself. Okay, I'm not seeing any public comment. Homebase or Jamie, do either of you?
No, not saying anything.
Okay, wonderful. We are good to move on then. All right, this is the portion of our meeting where we approve the minutes from our last meeting. Would anyone like to make that motion?
I'll make the motion to
I'll
approve.
make a motion that we approve the minutes.
Okay,
Second.
I got that from Lynn first, but Tony, would you like to second?
I'll second it.
Perfect. Thank you both. Is there any discussion? Okay, hearing none, I'm going to call a roll call vote.
Sorry, this is Deanne. May I just point out that there are misspellings of people's names, and I just ask that we clean that up in the future
Certainly.
minutes. Thanks.
Thank you for pointing that out. We'll keep a close eye on that. Okay, we're going to do a roll call vote for the minutes. Margaret?
Aye.
Terry?
Aye.
Leslie?
Aye.
Joe?
Aye.
Alejandra?
Aye.
Gabriel?
Aye.
Lynn?
Aye.
Doug?
Aye.
Lene? Deanne?
Aye.
Tony?
Aye.
Sean?
Aye.
Manjeet?
Aye.
Masaki? Maureen?
Aye.
Juno?
Aye.
Wonderful. We've gotten really quick on our unmute buttons, I have to say. Quite
Hey,
impressed.
Lindy, you also, I think you missed the Iman on the vote.
Yeah,
He's in.
I'm here as well.
Thanks, Iman. My apologies. I had you
Phenomenal.
marked as not here yet, but are you an I vote as well, Iman?
Thank you. I'm an I as well. Yes, thanks.
And Lindy Masaki is here. I don't know if she's got audio, but she wrote in the chat.
Perfect. Okay. Thank you. Do we have that home base in regards to the chat? Okay.
Yes.
We're good. Perfect. Okay, I think we're good to move forward. Okay, so we're going to begin with a COC NOFA update. I know for those of us who are involved in this, there's been lots of meetings going on and lots of exciting activities. So I'm going to turn this over to Shelby Ferguson to, I believe, begin with an updated coordinated entry COC project information. Shelby, are you taking this away?
Yes, thank you, Lindy. Hi, everyone. Good afternoon. I'm gonna very quickly and briefly talk about our coordinated entry project. We haven't really had an opportunity to talk to you all about coordinated entry in a while, so wanted to give some updates about what we've been doing and where we've been. Next slide, please. Thank you. So I want to take it back and remind us all of the HUD priorities of, kind of the idea of what coordinated entry is supposed to be doing and the components of coordinated entry. So really going from very high level to, we'll get a little bit more into the weeds of what coordinated entry does. So the HUD priorities came out in 2015 for coordinated entry, and they really haven't changed much. So one of the big things is that your system has some sort of prioritization process for how you prioritize folks getting into your system and accessing your services. Along those same lines, that you have a standardized assessment process and standardized access. So everyone has the same access into your system of care, and that you have a standardized assessment. In Contra Costa, like many communities, we use the VI-SPDAT as our housing needs assessment, which is our standardized assessment. And then also that it's low barrier, that we're not putting up barriers to people coming into our system of care, such as sobriety, things like that, and that it's housing first. So that we're trying to get people into housing first, regardless of their barriers. And then if they do have barriers, addressing those once they get into housing, but again, making sure that it's low barrier. So those are some of the main components of a coordinated entry system. Thanks, next slide. Again, really high level, I want to go back to our system performance measures and how coordinated entry fits into those. So most of our system performance measures have to do with reducing something. So we're trying to reduce the length of time that people are experiencing homelessness in our system of care. We also want to reduce the returns to homelessness. So once someone exits our system, we want to reduce them from coming back. Also, we want to reduce the first time that people are experiencing homelessness, which I'll talk about in a minute how we do that. And then we do want to increase our exits to and retention into permanent housing. And I will talk much more about that throughout the presentation. Thank you. And then quickly, I wanted to give kind of a high-level overview of where exactly coordinated entry fits in our system of care. That often is a very confusing point of what exactly is coordinated entry, where does it fit? So to give you a visual, we have this lovely system map. And coordinated entry really sits within the very center. It's that yellow circle. And it's our 3 access points is the main points of our coordinated entry system. That's really where coordinated entry begins. That's our call center, which is 211, our mobile crisis outreach team, which is our core teams, and then our drop-in care centers, Trinity and GRIP. So that's where coordinated entry begins. And as you can see, it really stems into all these different parts of our system, but want to give a really brief overview of where we start our work. Next. Okay, so I wanted to give a timeline of coordinated entry. Really, it started back in 2015, well before my time, when PSH was kind of the first little part of coordinated entry, prioritizing housing through permanent supportive housing. So that was kind of the first thing that we worked on for coordinated entry is how do we get rid of all these wait lists and prioritize people for permanent supportive housing within our system. And then we really expanded to have our 2 coordinated entry grants. We have a coordinated entry grant and a coordinated entry expansion grant. Thanks, Jamie. I'll try not to use too many acronyms. And then we moved into, in 2019, prioritization even further from just permanent supportive housing to rapid rehousing. We integrated into our prioritization process, just like permanent supportive housing back in 2019. And then in 2020, just right before the pandemic hit, we implemented a triage tool into our coordinated entry system, which I won't get too in depth to, but that's kind of the timeline of where coordinated entry started and where we are now. I also want to talk very briefly about our coordinated entry contracted providers versus coordinated entry participating providers. So we often get questions about that. So coordinated entry contracted providers are, people that we're providing funding to do their good work and to participate in coordinated entry and be a main part of our coordinated entry system. So those people are our access points, 211, our call center, our care centers, Trinity and GRIP. Also housing navigation, which is run by Hope Solutions. That's one of our contracted providers, as well as the Hume Center, which you probably know more as the Rapid Resolution Program, which is now called the Diversion Prevention and Rapid Exit Program. So those are our contracted coordinated entry providers. Next, I want to talk about our coordinated entry participating providers. So these are people who don't necessarily get funding through coordinated entry through one of our grants, but they participate in our coordinated entry system, are very involved in our coordinated entry system. So our rapid rehousing and permanent supportive housing programs are heavily involved in our coordinated entry system because that's how they take their referrals. We have, ESG funding, we have COC funding, and state and other state and local funding for those programs. I won't name all of the different programs we have because it's a lot. And then we also have our mainstream and emergency housing vouchers, which participate in coordinated entry because they take their referrals through coordinated entry. So we have connection with the housing authority. Next slide, please. Okay, and then I want to briefly go over our coordinated entry team. So our coordinated entry team is small but mighty. It's a coordinated entry manager, myself, and then we also have a coordinated entry specialist, Lakeisha Langston. And then as of October 1st, we added a coordinated entry specialist, Natalie Siva, to really help us with our emergency housing vouchers. So it's now a team of 3, but has been a team of 2 for quite some time, since 2019. So a lot of things going on with a very small team. Some of the roles and responsibilities of the coordinated entry team, really the CE manager is doing, coordinated entry manager is doing the macro and meso level work. And that includes, oversight of the general coordinated entry operations, as well as monitoring coordinated entry funded projects and programs, responsible for trainings, also provider meetings, housing placement meetings, and then our complaint process. The CE specialists, they really focus more on the meso to micro level work, which is, our housing referrals is one of the biggest things. Consumer and community inquiries about our programs, how to access our system. We get a lot of calls, a lot of emails. Those are go to our CE specialists. We also are responsible for participating in by name list meetings and case conferencing meetings, as well as homeless court. And then our new CE specialist, Natalie, will definitely be heavily focused on our emergency housing vouchers, since we have quite a few of those. That's a big, heavy lift. So we needed additional staffing for that. Case conferencing, facilitating those, as well as some trainings and helping us with our overall reporting. Okay, what everyone seems to be very much interested in is how people get housed through coordinated entry and how that process works. So to get housed through coordinated entry, the main thing to know is we prioritize in our community in Contra Costa based on their VI SPDAT score, which is our housing needs assessment. That's our standardized assessment that we use, as well as their length of time homeless. So that's how we determine, who's on our list and how we prioritize for housing that's available through coordinated entry. Thank you, Jamie. And we also want to point out that it's not a static process. It really is a dynamic process. So when we're going to match people for housing, we're not simply taking from the top just because someone's at the top, but really trying to match people to the most appropriate and available resource for them, which is one of the goals of coordinated entry. We also do case conferencing or housing placement meetings. That's how we facilitate referrals for housing through coordinated entry. It's a community process, community-led process, where everybody comes to the table who has a client that's perhaps on the list, but it's open to all homeless service providers. We talk about the people that are on the list. We have a discussion. We go through a standardized screening tool. And then that's how we determine whether someone is going to move forward for a housing placement. And then, like I mentioned, with our coordinated entry specialists, they're the ones who are doing a lot of that doc gathering. So they're getting the applications, clients' IDs, birth certificates, all the things that they need to get into housing. The CE specialists are gathering those, and then they're working very quickly to get that over to the new housing provider. So that's just a really, really quick overview of housing through coordinated entry. Next slide, please. Thank you. And I want to highlight the different projects that coordinated entry participates in, is responsible for, as one of our tasks. Specifically, I want to call out the tasks that we started as a result of the pandemic and during COVID. So one of the biggest things that the coordinated entry team started was provider calls. We started those at the very beginning of the pandemic, really to talk about COVID updates, since they were changing so frequently back at the beginning of the pandemic. So those were weekly calls, and they really turned into more monthly calls where all the homeless service providers are welcome to come, get information, get resources, yes, hear COVID updates, and then also hear from each other about different program updates that are happening. So it's a great place for our providers to get resources. That's been a great call that people really like. We also amended our prioritization process for housing through coordinated entry. That was back, if you remember, in August of 2020. The council approved us to amend our prioritization process for housing to prioritize those who were in Project Room Key hotels, to help us with our exit planning strategy for Project Room Key, since many of those hotels were going to be ending, and they have. We also provided a lot of support for Project Room Key. So we helped with a lot of case conferencing, by name list meetings, entering a lot of notes into HMIS to really make sure that we had all the information we needed for exit planning for Project Room Key for each participant, as well as tracked, housing referrals. And then we added 100 mainstream vouchers back in 2020 for our Project Room Key participants. That was part, again, of the exit strategy for Project Room Key, which was a really heavy lift for our team, and we're kind of just finishing that up. And then we added a bed reservation system, which I believe Kim talked about previously, in HMIS, which helps us track our shelter beds and who's being referred to those beds in HMIS. So those were our COVID coordinated entry specific projects. We also have some, PRK is Project Room Key. Our coordinated entry projects that we do regularly or not really as a result of the pandemic. We participated in the continuous quality improvement, which you've heard a lot about through Jamie Klinger, our research and evaluation manager. We also have our emergency housing voucher project, which you've heard much about, and I think you'll hear an update about today. We created a coordinated entry dashboard with our red team, which really helps us, monitor what's happening through coordinated entry, our referrals, our housing placements, how quickly we can get people exited into housing. We changed our housing navigation program just a little bit to open it up to all emergency shelters. So now our emergency shelters have more access to housing options for their clients, so we can create some flow within our emergency shelters. We, as I mentioned before, integrated rapid rehousing into our coordinated entry process in 2019, but that work continued throughout the past couple of years. We've done a lot of VI-SPDAC trainings for our housing needs assessment, as well as some other trainings like a housing case management training. And we've done a lot of case conferences, a lot of housing placement meetings, and by name list meetings. Those names can be used interchangeably, but really that's a time where we come together and talk about particular clients at a particular program, how they're doing, where we want to refer them, those kinds of things. We also participate in the veteran BNL or the by name list meetings and the veteran leadership meetings. So we have some participation in veteran services, such as SSVF, and then our screening tools, which are different than our assessments. Those are our screening tools that we use for housing through coordinated entry, and it's really just more of a discussion tool that we use in our housing placement meetings. So we've been working a lot on those. And we have some specific coordinated entry projects related to HMIS, some things that we've been working on. So we've definitely streamlined a lot of our referrals through HMIS, and we've been able to track those a lot better. So that's improved quite a bit, and it's been a really great add to our system. We've also integrated a lot of our projects into HMIS. Not all of our projects have been integrated, so we've been working with the red team to get them as many as we can integrated into our HMIS system. And then, like I mentioned, we're centralizing our referrals and placements in HMIS specifically related to coordinated entry and for specifically housing through coordinated entry. Okay, I want to talk about some of the challenges that we had. We all had challenges, of course, during the pandemic. So these are really related to the pandemic, but we saw a decreased capacity in our system overall. Our shelters had to decompress and had to move to Project Room Key. And even after many of the Project Room Key hotels ended, we still have decreased capacity within our system, especially for emergency shelter. We have seen a lot of housing demand. The housing demand continues to go up. We also implemented our triage tool, like I mentioned, just right before the pandemic hit, which was a challenge because that was a big deal for our system to integrate this brand new tool into coordinated entry and get people trained. And we struggled to get that done before we all had to go to remote working. So that was a big challenge for us. And then our system saw just a challenge with landlords and leasing up during the pandemic. Landlords were much more hesitant to lease up to our participants, which is understandable, but we definitely had a struggle with that. And then prioritization for housing, that amendment that we changed for prioritization for Project Roomkey participants for housing. That was a challenge because, we were only at that time able to prioritize people in Project Roomkey, but then that does leave the rest of the people in our shelters in other areas of our system where we weren't necessarily able to reach them. Next slide. However, I do want to talk about some of our successes that we had through coordinated entry. We made a lot of housing placements in the past couple of years. Even during the pandemic, we obviously made over 100 housing placements for mainstream vouchers, which was a really big deal. We've never had that many vouchers before. And we were able to house, 100 households from Project Roomkey for those mainstream vouchers. We also, during the pandemic, we got a new contract with Bay Area Community Services, or BACS, for a rapid rehousing project. So we increased our rapid rehousing stock, which was really great. Helped a lot of exit planning for Project Roomkey. We made, like I mentioned, a lot more referrals for coordinated entry, specifically for housing. We increased our housing stock through rapid rehousing and permanent supportive housing. And the one thing I really want to highlight is our length of time between assessment and move-in. As of our APR last year went down. It was an average of 22 days, which is a really short turnaround. And we're really happy to see that. And that definitely, just really attests to the hard work that our CE specialist has been doing over the past year to quickly get people's documents and get them referred for housing. And lastly, just want to talk about our next steps for coordinated entry. We've done a lot of collaboration with our RED team. They've been really great to work with, and we're going to continue to collaborate with our RED team to create more streamlined and standardized dashboards and reports. Again, like I mentioned, we added a second CE specialist, so we'll be able to have more capacity on our coordinated entry team overall, which is going to really help. And then we increase our housing stock, and we're going to continue increasing our housing stock, which is always great to hear. And that's my TED Talk. Thanks, everyone.
Thanks, Shelby, for all of your hard work and for that excellent presentation. I believe we have one other presentation under this. Mark, are you going to take this one?
Yes, I will take this part. Thanks, Lindy.
Thanks, Mark.
Hi, everyone. My name is Mark Mora. I work with an organization called Homebase. If you're not aware, Homebase, one of our roles in the Contra Costa County COC is to help coordinate this meeting. But in addition to that, we're also the neutral facilitators of the NOFO process, NOFO standing for the Notice of Funding Availability. It's a funding competition through the Department of Housing and Urban Development, or HUD. And it's a big competition across the country, funds a lot of COCs across the nation. And so I'm just going to give a brief update on letters of intent and applicants in this NOFO season. So really quick, the deadline for new projects to submit a letter of intent was September 15th, and we actually received 11 letters of intent for new projects. I am told this is a really high number. In fact, it might be the highest that we've received, at least in a while. So we had 11 LOIs for new projects, but it is common that we receive a higher number of LOIs than actual application submissions. So only 5 of those LOIs submitted applications. So of those 5 new projects, 4 are requesting what's called COC bonus funds, and 1 is requesting DV bonus funds. COC bonus funds are essentially funds that are earmarked for new projects in the NOFO process. And then DV bonus funds, that's a pot that funds housing projects that serve survivors of domestic violence. There's 1 application submission that's for an expansion of an existing project, and there are 2 applications from quote unquote new agencies, that is agencies that did not have projects that were funded in the last competition. So essentially 3 of the 5 new projects that were submitted are from agencies that currently have projects that were funded last year. Just a quick reminder, I did a presentation at the last COH meeting. The funding available for new projects for COC bonus is a little under 800,000, and for DB bonus, it's a little over 700,000. And as far as applicants, I just said that there are 5 new projects that are seeking funding. In Contra Costa, there are 19 projects that are seeking to renew their funding. The ARD is called the annual renewal demand, and that's a little under $16 million in Contra Costa. And ARD is basically calculated by adding the funding totals of all of the existing projects that were funded last year. So that ARD total is a little under 16 million. And right now in the NOFO process, we have kicked off what's called review and rank. Review and rank this year, there are 6 panelists. We're very grateful to have those panelists serving. They give a lot of their time to review and score applications. We're talking tens of hours of time to do that. As if there are any applicants on the call, you all know how much goes into all the materials and all the documents that you have to submit. So we're thankful to have six review and rank panelists. They are currently reviewing and pre-scoring applications. They're getting ready for our review and rank meetings, which are on October 18th, 20th, and 21st. The goal is to have a final priority listing reviewed by the council on October 28th, which was the November COH meeting, but moved up a week. For those that don't know, the final priority or the priority listing is this document that basically has 2 tiers, and projects that are submitting applications, they fall somewhere within those tiers based on the scores that they are given from the review and rank panel, and that determines which ones are funded in this process. So that's my presentation. Anybody have any questions? I don't think I see anything in the chat. Okay, so I will pass it back over to Shelby. I'm sorry, to Lindy. I apologize.
No problem, Mark. Thank you so much. We can actually move to the next slide too. Thank you. So we are going to start our committee report outs. As you can see, we've got a few of them today, but we're going to start off with Homeless Awareness Month, which I know Jamie's been working really hard on, and Juno's going to give us a little bit of information about the council members and what you all have been working hard on. Go ahead, Juno.
Hello. Can everybody hear me okay?
Yeah, we can hear you, Juno.
Okay, so council members have been working pretty hard. We've had a few meetings this week discussing mainly the process for scoring, the process for understanding scoring, and also the process for using our discretion in scoring. So a lot of stuff to do about scoring. And so I'm gonna try to synopsize a bit what we've been learning. Sorry, looking for my notes here.
And Juno, I just wanted to flag, this one is about the Homeless Awareness Month activities. And then I think we're going to talk about, because you're also working on the NOFA scoring process. Is that right?
Yes. Oh, goodness.
No, you're
My
good.
apologies.
You're involved in a bunch of things.
Yeah, I'm very frazzled. Okay.
You're good.
I think I have a wrong.
Let me know if you need
notes.
backup.
Yeah, I might need some backup, and I might have prepared the wrong notes here. Apologies, everybody. Some backup would be appreciated.
Absolutely. So while Juno's looking for notes, just a quick snapshot. We've had, we have a committee and then a bunch of work groups that are working on Homeless Awareness Month activities. And Juno's been involved in a bunch of them, so I'm not surprised your brain is going in a million directions. So we've been looking at, we've gotten award submissions, and that's actually something the council is going to vote on in a minute. We are working on a toolkit. We're working on a video. There's a panel discussion that's being put together, and then there's going to be a presentation to the Board of Supervisors by Lindy and Christy as our new director, and then we're going to have Joe and Juno as representatives with lived experience on the council that are going to present to the Board of Supervisors. Can you go to the next slide? Excellent. And Juno, if you want to jump in, let me know, or if you want me to keep going, I'm happy to do whatever you want to do.
You are doing great for now.
Okay.
Thank you for, yeah, thank you.
Okay, no problem, no pressure. So the council today, you all are going to be approving the awards. So as you might remember, there's 4 awards that are being given out by the council. There's 4 different categories. So in the packet that was posted were all of the nominations. And today we're going to approve those. Just a quick note about that. So as staff, I reviewed all of them as they came in and made sure they just met basic threshold for what the awards were for. If they didn't, I communicated with the nominees, but otherwise everybody that was nominated is going to be reflected in the awardees. And the committee, the Homeless Awareness Month committee, has reviewed all those too. We're hoping to launch our toolkit on the 18th. We're hoping to launch the video that we're putting together on the 18th. We are looking at, I think, the second week in November for the presentation to the board. And then there's going to be a panel discussion. We're putting that together on November 8th. And that will be where we recognize the awardees and then also have a really great panel discussion with some breakout sessions. And the planning group has some really fabulous ideas about that. Next slide, please. So actually these numbers have even, these are the representations of all of the numbers of people that were nominated for each category. There were multiple nominations for some people. So like, for example, Thriving in the Face of Homelessness, we actually got 24 nominations and 18 people. And I just have to say, as somebody who's been behind the scenes on these events for the last 5+ years, Thriving in the Face of Homelessness is a new award we've never done before. It's designed to recognize people with lived experience of homelessness. We got 24 nominations. Like, I was just so excited as a staff person to see all of these stories roll in. People were really thorough about why they were nominating all of these people and projects and companies. This is one of my favorite times of the year.
I want to chime in real quick.
Yeah, go ahead, please.
I wanted to echo that the descriptions that we have in that have been given in these sections are there's a lot of feeling in them, and I think that there's a really good job of organizing them done by Jamie and Joe and a lot of other people, I'm sure, as well, put in some work too. It's outstanding, the feeling that's in them. I just wanted to echo that.
Thank you, Juno. And I want to note, so the other thing we're doing as part of the toolkit is we are actually going to include the same documents that were in the packet that has who was nominated and why they were nominated, so that everybody's going to get to see all of the incredible work. The other thing that we're doing is we've identified what districts people are either from or working in. And so we're going to let the county supervisors know so that they have an opportunity too to recognize their constituents. So what you're going to be asked to do today, if you can go to the next slide, basically asking you all to, verify that you want to recognize all of the people that were in the packet. And then again, we're going to recognize them at the November 8th COC Learning Hub. We won't have time to name check people when we do the Board of Supervisors presentation, but we can include, again, the packet of all of the awardees and all of the great stuff in that packet, so it becomes part of the public record for the Board of Supervisors. And yep, it'll go in the toolkit. It'll be recognized at the COC Learning Hub and the Board of Supervisors, and also here. Happy to take any questions. I know that's a lot of information. Maureen, did you have a question?
No.
Oh. So what's before you right now is basically just to approve those proposed nominations to be recognized. Just a reminder, we decided earlier in the process not to identify winners, but that we're going to recognize everybody that was nominated that met threshold for the awards.
So I'll make a motion. I move that the council recognize or approve the proposal to recognize all of the the nominees listed in the agenda packet as awardees for Homeless Awareness Month.
This is Deanne. I'll second that motion.
Is there any discussion?
Just grateful for all the nominees and especially appreciate the new category this year.
Absolutely. Very inspiring. Okay, I will do a roll call vote. Oh, sorry, I just accidentally opened my agenda. Okay, Iman,
Yes.
Margaret,
Aye.
Terry,
Absolutely.
Leslie,
Yes.
Joe,
Yes.
Alejandra,
Aye.
Gabriel,
Aye.
Lynn,
Aye.
Doug,
Aye.
Deanne,
Aye.
Tony,
Aye.
Sean,
Aye.
Manjeet,
Aye.
Masaki. She might put it in the chat. Maureen,
Aye.
Juno,
Aye.
and I will join in on the enthusiastic ayes as well. So thank you all. That's actually going to be my last vote for the day. I'm going to turn it over to Lynn to lead us through the rest of the meeting. Thank you all. Lynn, it's all yours.
Thank you, Lindy. And moving forward, we have up next a report on the Youth Action Council updates from Juno. Juno, are you ready?
Yes, I
Okay.
have the notes for this one, so no worries. And also, it's been a great month for YAC, so I want to definitely tell y'all about what we've been doing. So we hit most of the goals that I've been monitoring and mentioning the past few months. First off, wanted to say that YAC members were back paid for their time working the past few months, which is fantastic. What happened is not entirely clear to me. Of course, I'm not a member of management, but I do know that there are, going forward, compensating YAC members for their time should be quicker, and we'll be able to award stipends to event participants as in addition to keeping closer track of who participates at events so that we can pay people more promptly. And I think that's really exciting for most of the YAC members, and I'm really happy to be able to tell y'all that that's going to be the case going forward. And I know there's been a lot of background work in making that happen, so I also quickly wanted to say a thank you to everyone who was involved in that. Next piece of good news for YAC, the Sugar City Get Down community event in Crockett also went fantastic this past month. A quick reminder, and for anybody who maybe wasn't here last month, the Sugar City Get Down was a community event, and hopefully will be again next year, organized by Randy and the team at Lucia's Craft Sandwiches in Crockett. It was both a way for the YAC members and Pomona and sort of the program there to reconnect in a safe environment and for YAC to refresh its touch points with the local community. So it went fantastic. Basically, we were able to achieve everything we went into it, going into it wanting, and our YAC team did great interacting with the community. And also our newest member, Corey Simmons, especially did a great job showcasing his barber skills, which a lot of the community did take great notice of. So it was a great time. I wasn't able to be there myself, but I was told it was a great time. And I think that is all from me from YAC this month. So good month for YAC.
Thank you, Juno. That was a great update on all of the YAC activities. Next up, we are moving forward with the EHV working group update. This is by Tony Yusufery from the Housing Authority.
Thanks, Lynn. Hello, everybody. real quickly, the EHB working group kind of spawned out of the Oversight Committee, and we've met a couple of times on September 9th and October 1st, and we actually are meeting again tomorrow. And we're focusing on, getting all these vouchers out on the street, get people into units and start getting rental subsidy. Up until now, we've been working out the details of our memorandum of understanding, kind of retooling our prioritization categories. We've been talking about setting priorities or minimum number of vouchers we want to see issued within each of the categories. We haven't set any maximums because we know that as we start the ball rolling, things are going to change. There may not be as many people in permanent supportive housing that want to move on, in which case we'll focus more on long-term stayers. We've also been drafting up a number of the different documents that are going to be part of the emergency housing voucher program, and tools that coordinated entry is going to be using to qualify people. Some of the questions that we still have to work out is deciding whether there should be any aftercare tied in with emergency housing vouchers that would be provided by the providers involved. There really isn't any funding for it, so it's kind of hard to say, hey, go do this and not get compensated for it. But there's a certain amount of expectation that we keep tab on the families, make sure that they don't take a voucher, go live in a private unit somewhere, and then not have any support. The other is, how are we going to figure out who actually is eligible to receive and succeed with an emergency housing voucher in without supportive services? So, what's the criteria to decide whether somebody, even though they've been in permanent supportive housing over 3 years and been paying rent and everything's great, are they truly ready to live without supportive services? Next slide. So, we originally talked about having the Moving On program, addressing the needs for permanent supportive housing as well as rapid rehousing, long-term stayers and shelters, and also having a transfer policy within the permanent supportive housing and rapid rehousing environment. But we realized when we looked at the numbers, there aren't very many people that are in rapid rehousing that would necessarily qualify for emergency housing vouchers, let alone need the transfer. So we're focusing more on the permanent supportive housing, moving on criteria, and the long-term stayers. So we've narrowed it down to those two groups. We had, next slide. When we did a data poll to see what the numbers kind of look like, and out of the 201 vouchers that are available, we've identified 649 households in the permanent supportive housing environment that are quote unquote moving on eligible, and then the long-term stayers and the shelters, there are 272 households there. And from this, we kind of proposed some minimums, and if people have an opinion about what those minimums look like or should be, this would be a quick way to voice that, and maybe throw it in the chat for time's sake. But we arrived at a 20% minimum of the vouchers, of the 201 vouchers. So that's basically 40 vouchers minimum would go to permanent supportive housing moving on, and 15% of those units would be part of the proposed minimum for long-term stayers. That would include, this says 28, we've received 25 referrals so far already from coordinated entry. If you recall, we had told you that in the interest of time and making sure that we're not just waiting for policy and documentation to get created, we decided to start with a little pilot group of long-term stayers. And so 25 households were identified and referred to us. 3 of those households have vouchers in hand or out there looking for units to move to. There are 2 more that are, pending briefings. We go through a briefing process with the households before we actually issue the voucher. 2 more are pending those briefings. And then the rest of those 25, the 20 or so households are in various stages of readiness, either still needing to be interviewed because they haven't responded to our outreach or missing some documentation, those kind of things. So hopefully here in the next couple of weeks, we'll have a lot more activity with those households and have vouchers in their hands. Next slide. So, so these are some of the things that we've been working with, not only with policies, but also documentation. But there's the whole emergency housing voucher coordinated entry policy, which is slightly different than the regular coordinated entry policy. We have a screening tool that we are creating that is, has been so far the existing coordinated entry screening tool, but we're going to add some layers to that to kind of get to a better level of readiness and assessment for the families to see whether they can live without those support services I was talking about earlier. We have certification forms that we've been finalizing. There's a candidate interest form that'll go out to all those, roughly, almost 900 households to see if they even want to participate in emergency housing voucher, or if they're fine where they are. There's an aftercare standards of practice that we still need to not only discuss, but make sure that it's clear to all the providers that, what's expected of them once they make a referral and the voucher is issued and that family's housed. And then, we're also talking about communication plan for the providers. There's probably going to be some training that has to happen, especially with a new assessment tool. And there's a grievance process that is required to be in place for the COC. So we're looking at that and making sure that it's, going to meet our needs in the process. Next slide. So as I said, we meet tomorrow again. I think that the main focus tomorrow will be to, get a good grasp of the assessment tool, and then hopefully reach out to providers, have a separate meeting with them just to kind of do a one-day quick, take a look at this and see if you think it's going to work and it's going to be efficient in terms of assessing people. There'll be another oversight committee meeting in October where we'll review all of the documents and the forms and policies that we're currently working on with this little work group, and ideally have some consensus on that so that we can go to work and start assessing the families involved and get them referred to our agency and have vouchers in hand. So if anybody has any questions, I can take those. Otherwise, I think that's the end of my presentation.
Thank you, Tony. Any questions on Tony's presentation before we move forward? Appreciate that very thorough and informative update. Yes, Leslie.
Hi, yes, thank you. I appreciate that we have raised the question of long-term support, but with the EHV vouchers, is there also going to be assistance with housing search? Or I know in the case of PSH families, people, will they be able to stay in place or will they have to find new homes? And if so, is there housing search?
There is housing search. Great question, Leslie. First of all, for people that are in PSH, if they want to stay in place, that's great. It's a quicker lease up, and it's just a matter of executing a different contract. That's it. For those that want to go somewhere else, we're almost at a point where we're finalizing the contract with a navigation assistance for the EHV households. And once that's all inked and ready to go, then we will apprise the families that are participating of who to contact when they need navigation assistance, whether if they need it. If they don't need it and they want to do it on their own, fine, but it will be available.
Great, thank you, Tony.
Great. Any other questions? Hearing none, we'll move forward to nominating committee report out by Jamie.
Hello, everyone. It's me again. Thank you. So I wanted to do an update. As you hopefully remember, we are seeking applications for a number of different seats on the Council on Homelessness that are either open or opening up. And I wanted to just give folks a thumbnail sketch of where we are in those applications. And I think actually a few more have rolled in for different categories as since this got posted. I say this all to say, you can see there's some areas where there's no or low number of applicants. The deadline is next Friday. So if you're in one of those seats and you want to be back in that seat, you have to apply. If you fall into any of these categories and you're interested, by all means, throw your hat in the ring. This year we have the standard application that the county requires, like the CAO's office. And then we have a more robust supplemental application that folks are asked to do. And that's going to help the nominating committee really assess somebody's interest, what they might be bringing to the table, and also some demographic information so that we can try and create a council that's as representative as possible of the community we're serving on a bunch of different axes. So this is just a reminder, the deadline is Friday the 15th, I think. And I will drop the link in the chat about how folks can apply and the descriptions of the seats. I'm really excited to see so many applications for some of these categories where we haven't had a lot before. The nominating committee, after we get all of those in, they're going to be meeting the week after to review. And basically, when they come back to you on October 28th, they will have recommendations for their top choice for each of these seats. You guys will decide if you approve that, then it will go to Family and Human Services and then to the Board of Supervisors, with the idea that people are officially installed in their seats by the time the new year starts. I will also flag as part of this, we in January will need to be looking for a new chair and co-chair potentially. So Lindy will not be reapplying for her seat. Lynn has been vice chair. So we need to start thinking about that. So if you are already on the council and your seats are secure, start thinking about that for next January. Any questions about any of this? And I think that's it for my slides. Mark, do I have another slide?
I have a question real quick.
Yeah.
That EHSD, if it doesn't get filled, what happens? And what does EHSD stand for?
Thank you. Look at acronyms. Okay. So the COC, I'll start at the beginning. So the COC ESG seat is basically for agencies that are funded by Continuum of Care funds, which basically comes down through the federal government through HUD, Housing and Urban Development, or ESG, which is Emergency Solutions Grant, which is sometimes federal, sometimes state, that also basically funds homelessness. So the idea for that seat is somebody that is basically, a grantee of those funds, so an agency. EHSD is Employment and Human Services Department. So Lynn's in that seat right now, and it's basically looking for a representative that is working in Employment and Human Services Department at the county, because it is such a huge player in all the services that impact our population too, right? So working with a lot of the same people, we have a lot of crossover. So making sure there's a representative from there. If there are no applications, then it stays open and we will do another call for applicants. Does that answer your question, Joe?
Yeah, it does. Thank you.
Yeah. Dale, I see you have a question.
Yes, where does a community member get an application?
Great question. I'm going to actually drop a link in the chat. Do you have access to the chat on this meeting?
Yes.
Great. We've been sending out big blast emails, so I'm going to put two things in the chat. One is a link to the application information, and the other is will be a link for our mailing list. So if you're not already getting emails from us, so we send out like a monthly newsletter, but we've also been sending out blasts when we have these open seats. We'll make sure you get on that. So I'll drop that in the chat. Any other questions?
Okay. Thank you, Jamie, for that report out. And moving forward, we have on our old business, the staff report from Mark from Homebase.
Awesome. Thanks, Lynn. Hi again, everyone. This is the part of the agenda where we just draw attention to the staff report, which is included in today's meeting materials. Just want to give you a chance, if you hadn't, to look at that. That's where a bunch of important information lives, but is not super urgent to have required a verbal update at this meeting. We're trying to make the time more efficient for you and not to have too many updates and overwhelm you. But there is a lot of information in the staff report. So just wanted to take a moment to see if there were any comments or questions about the items in the staff report. And Jamie told me to leave a bit of awkward pause, just in case. Okay. If there are no comments or questions, if you hadn't had a chance, we just encourage you to take a look at the staff report. There's some good information for the COC there.
Great. Thank you, Mark. So moving on, we have new business, the new public meeting teleconference rules, which is AB 361, and turning it back over to Jamie.
Thank you. Next slide, please. So I have some good news and some annoying news. The good news is the state has decided to allow Brown Act covered meetings like this to stay remote up through 2024. The annoying part is, if we want to continue to do that, we will need to have an item on our agenda every single meeting and re-up that every 30 days.
Jamie, can I
Yes.
stop you for just a
Please.
half a second?
Oh, please.
So Tuesday, this past Tuesday, the Board of Supervisors did go ahead and pass that resolution, and they made it applicable to all advisory bodies in the county, so you don't have to do anything. They will re-up it in 30 days, and it will
Bill?
be.
Oh my God, I love you so much. That's the best news all day. Okay.
Yeah, so you're good to go.
Oh,
There's
I
only
agree.
3
Thank you.
advisory bodies in the county that actually have to do it individually, and because they have statutory requirements, and you're not one of them, so.
Bless you. So forget, we don't have to do this. We are blessed. So Jill, we just get to continue remote until we hear otherwise.
Yes, there's some minor things that I know you're aware of, which is if people can't access the meeting, it has to end and those types of things. So, but yes, you are set, you are good to go. And in 30 days that will be back on the Board of Supervisors agenda.
Excellent. I'm always happy that you're here, but I'm especially happy that you're here today. Thank
And
you.
a little addendum as well is the Board of Supervisors has asked staff, meaning County Administrator's Office, to really look at how do we move forward and allow for public participation in these types of meetings, even outside of an emergency order, because it's worked so well for people to be able to really participate virtually. So that's more to come on that.
Thank you, Jill. And Jamie, thank you. Are we passing through so no action item required? Okay, great.
You don't have to deal with any of that. You don't have to look at those slides. You don't have to vote on anything.
Okay, that's good news. So we're moving forward with the provider presentation from the PACE program from CEI, Center for Elder Independence. And we've got Maria Zamora and Lenore McDonald on the line.
Hello,
Take it away.
everybody. This is Lenore McDonald, and unfortunately, Maria Zamora is unable to join us today, our CEO, but I'm very happy. I've been waiting for a while to tell you all more about a program, and this particular agenda is very fitting too, because I see a number of ways that CEI hopes to partner and be a provider in the homeless space here. And so let me tell you a little bit more about PACE, Center for Elders Independence, and our supportive housing project. Next slide, please. So first of all, what is PACE? Next slide, please. So PACE stands for Program of All-Inclusive Care for the Elderly, which is a mouthful, which is why it's more commonly known as PACE. PACE is a healthcare plan. It's a Medicare plan, and it's overseen by CMS, the Centers for Medicare and Medicaid Services. It's a national program, although it was started right here in the Bay Area in San Francisco by the provider named Unlock, who is celebrating their 50th anniversary this year. There are 131 PACE programs across the country, but like CEI, we have 6 sites. So there are 263 PACE centers in 31 states. Next slide, please. So Program of All-Inclusive Care for the Elderly, the emphasis here is on all-inclusive. The purpose of the program was originally and continues to be designed to keep elders out of nursing homes. All of the members in PACE are skilled nursing facility level only, so they're certified by the state in this case, and only 5% actually live in nursing homes. So when you're looking at CEI, our long-term SNF enrollment is very, very small, maybe 1%. We currently care for roughly 1,000 people. We do use SNFs for short-term recovery from incidents, hospitalizations, and all, but in general, our goal is to keep people out of nursing homes. 100% of our folks are on Medi-Cal, so it's very, very low income. 85% are also on Medicare, and you'll hear the term Medi-Medis. That's what that refers to. We coordinate all medical care and social services, and the social services is what makes PACE unique out of any other Medicare program. We do it all, and this little slide here gives you an example actually of the services that we are required to provide as a PACE, including all medications, spiritual care, home care, eye care, meals. We have rehab therapies, recreational therapies, occupational therapy, physical therapy, dental services, do socialization in our day centers, all hospitalizations. So our folks get sick, they have accidents, they need to go to the hospital. That's all on us. We do take care of all of that. Podiatry, older folks have sore feet is no fun. We recognize that that's a key service to provide. We have a great big, beautiful senior gym at each one of our facilities. The one in Concord that we just opened is particularly big and robust. We provide all transportation. So not only do we provide transportation, but we get to drive the bus too. We own and operate close to 60 paratransit vehicles in our fleet and provide transportation to and from the centers and all medical appointments. We contract with a great deal of other providers in the community for x-rays and all, although a lot of these services have become mobile. We provide all of the medical care. All of our physicians and nursing staff are geriatric specific. They're certified in geriatrics. We provide all emergency services and medical specialties. All medications actually are also delivered to the home, so that that cuts out the need to go to the pharmacy and all. And updates are done very easily. Next slide, please. So PACE makes seniors' lives better. You know, as I mentioned, 100% of the folks, it's a qualification that you are eligible for skilled nursing level care. 100% are on Medi-Cal. 94% of our folks live at home. 4.5 years is the average stay in the program. And 95% of them would recommend CEI to a friend. So as a healthcare plan, we're very pleased with these numbers, and these are standards that we live to. Next slide, please. So who is CEI? Next. So CEI is celebrating our 40th year anniversary this year. The Center for Elders Independence was actually started with the support of the County of Alameda. We started as in an abandoned wing at Highland Hospital, and started out with 40 disabled folks, elders who needed care, and they were frequent flyers in the emergency room to see how we could wrap around services and keep these folks stable and out of the hospital. We have been a recognized and stable leader in PACE. As I mentioned, Unlock is the original PACE program 50 years ago. We were the 9th program in the country. We are a nonprofit community-based organization. We're financially stable, and we've been growing steadily for the last 40 years. We converted from being a simple adult day care center in 1992. And we've been serving West Contra Costa County, in Contra Costa County since 2000 from our center in Berkeley. We also purchased the Guardian Adult Day Center in El Sobrante about 4 or 5 years ago. So we're very pleased to be in Concord now because it's we're more centrally based, and we're closing in on a gap of folks that weren't really eligible for PACE, or we couldn't get PACE services to them before. We have 1,200 participants in PACE, between Guardian, and we're also the waiver program here for the home and community-based waiver. We're the agents for Contra Costa County and Alameda County, and approximately 400 people are enrolled in that program. Next slide, please. And this is where our locations are. So we're in Oakland, San Leandro, covering most of the southern part of Alameda County. Our center in Berkeley. There's Guardian at the top and on the left, and then our new PACE Center in Concord, which opened and started enrolling people last March. Is our 6th site. Tony, let me tell you a bit more about the community waiver program as a follow-up to this, because it's a wonderful program here. So eligibility for PACE. PACE is 55 years or older. A lot of programs that serve seniors, the threshold is 60 or 65. So we're able to provide services for a younger population. In the Concord Center, you have to live in Contra Costa County. You have to be eligible for SNF care, and you have to be able to live safely in the community with the help of PACE. And by that we mean, we will actually do home assessments because we are delivering services in the home as part of our enrollment criteria. The average PACE participant is 73 years old. They have 12 medical diagnoses of chronic illnesses. The majority suffer from some memory loss or behavioral health issues. They need help with at least 3 ADLs, personal care, most often bathing, cooking, and dressing. So we have a whole team of home care aides as part of our interdisciplinary team. 100% of them are on Medi-Cal, and many live in affordable housing. Some of our folks have previously been without housing. Next slide, please. So what is the PACE and supportive housing model? And how would that fit into what Contra Costa County is doing for homeless services? From our experience, and I'm sure all of yours, there's challenges specific to homing on the unhoused population, especially chronically homeless folks. Many have experienced trauma. They need advanced medical health support, oftentimes 24/7. They've had deferred health care. I think you may be aware, living on the street for a year will often put almost 10 years, add 10 years to a person's life. It's hard out there. They have multiple chronic medical conditions. Many are involved in substance abuse disorders. And older folks need transportation. They also need, they suffer from food insecurity, and they need help in the home with bathing, dressing, and other assisted living needs. Next slide, please. So how does PACE and supportive housing model work? So permanent housing, we provide, and this is what PACE does. It enables folks to continue to live at home. And in the case of folks in a homeless program, people that are in public supportive housing now, as their needs change, they'd be able to continue to live in the place where they're living with the support of a program like PACE, and not move into a nursing home or other long-term assisted living facility. We help people move in. There are really no demands on the tenant. And in the case of working with a developer and stuff that or organizations that are building or maintaining housing, there's no cost to the tenant. So PACE, or to the developers. So PACE is a capitated program and we're funded through Medicare and Medicaid, and it is not, there's no cost to a housing partner to have a PACE participant living with them. And then we coordinate all of their services. So behavioral health assistants, we have licensed behavioral health social workers at every one of our sites. We also have a psychiatrist on staff. We provide all the transportation needs. And so if somebody's medical needs change again, they can continue to receive the support that they need to stay housed. Home care when it's needed. And we even have home delivered meal services for those who's either short-term or long-term are no longer able to prepare or purchase food for themselves. And then we provide all of the activities that they need or want. It's somewhat optional, but we do try to get as many people into our day centers who can and want to, so that they can socialize. And there's a lot of observations going on there. And then all of the medications that folks need are provided as part of PACE. Next slide, please. So PACE and housing benefits a community. There are certainly fewer homeless citizens, but in addition to that, a lot of the emergency services are less impacted. If you have we are able to provide services so that our folks call us first. So, there's fewer emergency room calls to the fire department or the police, 5150s. There's less emergency use and less stress on the county mental health systems. Also the food programs, in many ways we contribute to the whole safety net of services that are in place to help homeless folks. The next slide, please. So I want to give you some examples, and I personally have visited all of these sites. There's a very robust PACE and supportive housing program in San Diego. And St. Paul's PACE really broke ground with this program. They were contacted by the city and the county to work with the coordinated entry system to see how they could keep people housed. And so I'm going to show you 3 examples. And the first example, this one, this particular apartment building also has 3 floors, and it's got children and youth in one floor, PACE participants who are seniors in another floor, and then the 3rd floor was for families. This was a renovated apartment building. Parker Kerr is the developer. And the San Diego Housing Commission was the partner. There are 11 apartments set aside for PACE participants in this particular facility. And so as new people come and go, we're referred through the shelters and other referral agents through the county's coordinated entry system for people to be eligible for these apartments. And this has been a going concern since 2013. Next slide, please. Celadon in San Diego is perhaps the largest program. This is constructed in 2015, and it was constructed newly specifically for homeless population. St. Paul's is the PACE provider. Bridge Housing was the developer, and 63 apartments in the facility are designated for PACE participants. And Talmadge Gateway is brand new, and this is a picture of it here on the right. It's a beautiful facility, and this has really had a big impact on the entire neighborhood there, which had quite a bit of blight. It was new construction again for homeless folks. The St. Paul's PACE is the PACE provider. Wakeland Housing and Development Corporation was the developer. This entire complex is for PACE participants, so it's 100% PACE. And it is, we have learned a lot in terms of how to best serve this population in a complete congregate setting. They love it, actually. We get a lot of comments. They're very protective of the complex. As you might imagine, sometimes in a dormitory setting, for instance, students will leave the door ajar so the pizza guy can come and this and that. And these guys are very, very astute in terms of who's coming and going and security and all. They really love this place, and they don't want anything to jeopardize their comfort and their lifestyle there. So they're very actively engaged in helping keep it a safe and vibrant community for these adults. So next slide, please. So how would we establish a PACE and supportive housing model here? CEI is very intent on bringing this model up to Contra Costa County and Alameda County as well. We were active in the Project Room Key program in Alameda County and learned quite a bit about on emergency conditions, what people's needs are and all. And I think we have time and an opportunity to do this in a very thoughtful manner, in Concord, and there's a lot more infrastructure in place in both our counties to support a program like this. So the next steps would include building on the partnerships that we already have. We are, CEI is at the top of the list for many of the supportive housing developers where many of our residents live in both counties. RCD, we're co-located with RCD at our site at Berkeley. RCD runs the Mabel Howard Apartments upstairs. Lifelong Medical has the over 60s clinic for people who are not yet skilled nursing eligible. And then CEI's PACE clinic is also co-located there. So as people's needs change, the residents there can just move through these programs and stay there for the duration. We are also co-located with Ebalzi, which is the East Bay Asian Land Development Corporation. Our first site at the San Pablo Hotel, which is a single room occupancy hotel with 144 rooms. CEI's PACE clinic is on the base floor of this, and many of those folks are enrolled in our program. And short-term, we do short-term intervention there as well. Satellite Housing is another great partner of ours. We're not co-located with them anywhere, but we have many of our residents living there. And Human Good as well. The Allen Temple Apartments on International Boulevard have many PACE participants. So we've been partners with these organizations for many years. And we keep their residents living in these apartments safely and with sound medical treatment. So we have this experience. We need multiple community partnerships to make this type of a program work. We certainly need a housing developer, and there are no shortage of them. But these are specifically for supportive housing units. It's different. We need a PACE, and we can be that provider. We have the ability to serve all of Contra Costa County. We have that's included in our service area now. Community service providers to make referrals. I know in this case, the coordinated entry system, which is just doing a remarkable job. Shelby, your presentation is really, it's impressive. And I know Tony too, trying to get the infrastructure in place to put these vouchers that are coming through HUD to the best use possible is really what it takes. And then, you know, having a partnership or a workflow where PACE would be an asset that we could use, especially with what we found, even with Project Roomkey. I think personal landlords, private landlords were much more apt to consider a participant or a family or somebody, a newly homeless person who was enrolled in a program like PACE because they know that they have a lot of robust services keeping them supported. City and county planning and regulatory departments, you know, to build and to locate some of these facilities in certain areas of need. Take planning, and so you know, working together on the front end to try to get these going, working with HUD to designate properties, and the financing is stipulating in some of these agreements that PACE will be a part of that program is also beneficial to their success. Elected officials, of course, and community residents too. St. Paul's in San Diego relies on a very big group of folks that come in and help people move into their apartments. They do fundraising for furniture and other supplies and things that they need so that people are able to transition easily, and it's a good experience for them. Next slide, please. We also have learned over time that you know, to consider renovation as opposed to starting with new construction. That just because of the timeline, and I know I'm preaching to the choir here, but it's takes a long time to get one of these programs funded, and then to get all of the entitlements and all to build a brand new building is a huge commitment. Whereas renovating an existing building can take far less time. And so oftentimes you can do concurrent activities and reduce the timeline as well. In terms of setting up the enrollment process and what have you. Next slide, please. And so, you know, our purpose really to tell you about all of this is that we really like to work with you. You know, with so much money coming through the federal government right now to support the development of more housing, and the needs of a growing older adult population. As we all know from the census, we're, you know, north of 25% in many communities, people are over the age of 65. And just the fact that people are living longer, so their health needs are more advanced through their latter years, and they will change over time. We've also seen how vulnerable older adults were, certainly to COVID, during COVID, and the whole nursing home environment. We'd like to do whatever we can to keep people from continuing to use that model as we transition through greater needs in our lives. And so let me pause there and answer any questions and comments you might have about the program and how we might work together with the Homeless Council to get things going here. So, Joe, did I see your hand go up, Joe Bruno?
I think it was a
No,
clap.
that was just a hand clap.
Oh, I see. Thank you.
Yeah.
There's a question in the chat.
What would SUD? What is that? Substance abuse disorder. You know, we many of our folks have substance abuse disorder, and you know, at CEI we treat that through a number of ways. We have individual programs that work together with an individual on a care plan. Everybody has a personalized care plan. And so as part of their plan is how to manage these things. And, you know, it is a challenge, I will admit that, you know, being an organization, we are not 24/7. So for us, it means that we have to work carefully with our participants to help them reach their goals. to stay in the program. And, you know, for somebody that really doesn't want to stop using, if there's no interest in cessation for these things, PACE may not be the right program for them.
We have another question in the chat. Is PACE participating in the housing, or CEI participating in the housing element discussions happening in cities throughout Contra Costa?
Oh, absolutely. And I think that, you know, we're very active in the housing work group for the ACOA. I co-chair that actually with Jerry Richards. And you know, we're more than happy to. We are also working in with Human Good to see about housing development, you know, to see about, we're doing feasibility studies right now to see what might be possible for building more housing. But we're here to put our, you know, hand out and really offer to work with anybody that we can to get this going.
Tony also has a question.
Yes.
His hand is raised. Go ahead, Tony.
Yeah, I just wanted to bring up that community waiver program again. And
yes, so the 1115 waiver programs are run by the state of California, by the Department of Healthcare Services. And what we do in that role, what CEI does in that role, is to coordinate home care services for individuals who are eligible for the program through the state. These are folks with severe developmental issues, physical issues, but they're all ages, Tony. So you know, the PACE program is for people 55 and older. We coordinate these services with community health and public health and private providers for folks who are eligible. So, you know, we manage them, and then we also bill back those services to the state to make sure these providers are paid for them. So it's a big lift. And we do this we're the agent for Alameda as well as Contra Costa County. And so we have a whole separate staff that manages the coordination of that kind of care. A lot of people with that are bound to respiratory assistance, oxygen, you name it. So that's what that is. And that program, by the way, is not part of the CalAIM overhaul of Medicaid services right now. It's been grandfathered in, so we're going to be continuing in that capacity. And Choice and Aging actually does the evaluations for 1115 waiver candidates in Contra Costa County. So we work with Deb Toth's staff on that. And I can find more information for you if you'd like, and I'll send that out. Anything else? And let me ask you, I mean, you know, in terms of the folks that you're providing for now, you know, as I listen to the presentations, it seems to me that there might be people who are on the wait list for supportive housing who may actually benefit from PACE or may be eligible for that. Not that they've been on the list that long, but that maybe that with support services, you know, they could do once they're placed, you know, may actually benefit and be interested in a program like ours. Do you think that's true? And Tony, and that, you know, as you're and Shelby, as you're doing your evaluations, you know, do you feel that there might be an opportunity for some folks to look at the PACE program?
Yeah, I think, you know, educating people about what's available out there and knowing, you know, this is an option is good even for us, so that when we're working with the population, we can say, hey, you know, here's an option for you.
Yeah.
So this is helpful.
Okay, great. And then in terms of the counties, you know, actually, you know, moving ahead and building more housing in some of these communities, you know, we would, you know, very much welcome being a part of that discussion as well. And because I think that, you know, we have a good model to work from. This is also a model that's put in place in Boston and New York and some other cities across the country. But right here in California, it's been very successful. This program is actually accounts for more than 60% of the population that St. Paul's is serving in San Diego right now. There's more and more coming online all the time. So, no.
Thank you, Lenore. I just want to applaud the work that you do and also attest to the CEI's work in Alameda County. And we had worked together during my time there, and a major partner for social services and our Aging and Adult Services Bureau, both in Alameda and here as well. And so, I think there are definitely opportunities, for the linkage of, the work that you're doing, and also those who are in either on the waiting list or in supportive housing, or, if as more units are being built, that there's, collaboration, and really appreciate your excellent and very thorough overview of the work that you do nationally. It looks like that you have a presence and also statewide. And so just really appreciate your overview and your time today on this. And her information is here on this slide, both Maria and Lenore's information, and how to contact her if you have any questions following today's meeting. She is always available.
Absolutely. And we can also provide a tour for anybody here, and organize one. I know we talked about that earlier, and we're certainly ready to do that at any time. To see the facility and to see folks interacting there, to see the clinics, meet some of our medical staff and social services staff, I think would be beneficial as well. People enroll in PACE most often through direct contact with our enrollment staff. So we have people that are working specifically in the Contra Costa County area, who really get to know a lot of the agencies and the housing and senior services group. So they're well versed, and so we can walk you through what that process is and get to meet some of our staff. But we'd love to show you a PACE center. The Concord Center is beautiful. It's open. We already are enrolling seniors in the facility now. It's located right over by Waterworld on Civic Drive near downtown Concord. So I'd be happy to follow up and arrange that for anybody who'd like to go on a tour. And I know Tony and you and your staff have expressed interest already, so we'll get that going. So thank you all very much. We really look forward to working with you in any capacity, but this is a big initiative for CEI. We really are very intent on working with the homeless population, and really are excited about the work that you're all doing and how we can contribute. So thank you very much.
Great. Thank you, Lenore. So we are moving ahead and ahead of schedule, looks like. And so Jamie, we're opening it up to announcements. If anyone has anything to share, I see Tony, you have your hand up. Go ahead.
Yeah, I wanted to, timing is everything. So I don't know if this is going to happen before the next council meeting. So I wanted to give people a heads up. We, as you know, we're the grantee for the COC funded rental subsidy programs, what used to be called the Shelter Plus Care program. And H3 has been acting as the sub-grantee for that Shelter Plus Care funding. Gosh, it's, 20 years, I guess. It's been a while. But things have grown with H3. They've got a lot more responsibility these days. So they're stepping back from that responsibility. And we will be putting an RFP out on the street here sometime later this month to find a new sub-grantee who wants to take on the role and responsibilities of acting as the sub-grantee and doing a lot of the work that H3 has been doing around the rental subsidy programs. They'll be working closely with the Housing Authority. It's kind of a new iteration of the way things have been set up in the past. And there'll be a little more monitoring involved. And, then some of these things have come up from HUD reviews of our program, wanting us to be a little more proactive in monitoring subgrantees and so on. So we've done some of that in the past. We've, generally been the purse strings, and we, make sure we give a lot of flexibility and, freedom to the subgrantee to do intakes and, qualifications for people for the program. And, they then refer them to us, but there'll still be a relationship with H3, the coordinated entry system. Some of the support services that are tied to them, to the program, will be tied in with H3 as well. So a lot of those things are still being discussed and worked out. But I do want to let folks know that if you're interested in being the new subgrantee for those for the Shelter Plus Care or COC funded rental subsidy program, be looking for that RFP. It's going to be posted on our website later this month. We'll send word out through the continuum as well that it's available, and how to download it, and there'll be all the timelines in there. We hope to have somebody selected and starting to work by somewhere around February 1st or March 1st.
Great, thank you, Tony. I see Joe's hand up as well. You have a question, Joe?
Yeah, an announcement. Joe Bruner here, peer support specialist. I just wanted to give a heads up that the project that I've been working on with the getting the lived perspective, the lived experience perspective of those who are unhoused, we're moving forward. We're building this peer network, and my niche is very, very specific on how to outreach to people who are unhoused, so we can get their lived experience perspective, show them a way to, build a message of hope, looking at peer support specialists and all this stuff. So it's coming to head, and our first meeting will be coming up next Tuesday. So we are literally just building this network right now, and we're on to the next step. And there's going to be an overlap there'll be a little bit of an overlap with the council and how we can work together with people who are working with the unhoused population. So I just wanted to let you know that it's looking really good, and the outreach factor to get that perspective. We're building the constitution of intent and best practices behind the peer support side of things. So that is moving along very nicely. Thanks.
Thank you, Joe. We have a couple other hands up for announcements, and I do see the slide from Tarina Wilson on the county's housing element updates underway.
Yeah, hi everyone. My name is Tarina Wilson, and I work with a firm called PlaceWorks. We're a consulting firm that's been chosen by the county to help them update their housing element. And we are currently conducting outreach to stakeholders in the county to help us understand how housing for underserved communities are or are not getting built in the county. So we're holding a focus group on Wednesday, November 3rd for service providers in the county, just to help us gather more information, identify barriers, and then also look at potential solutions to those barriers when it comes to providing housing for these sensitive populations that you're all serving in the county. If you have interest in participating, you can reach out to me. I will put my email in the chat, and you can send me an email to receive the invitation email and the Zoom link for the meeting. Some of the faces here, I already have you RSVP'd, so that's great. Thank you so much. I know that Jamie had sent out an email to your network, so we have quite a few people signed up, and that's great. But if you would like to sign up, you can email me with the email I'll put in the chat. And I hope to see you there. Thank you for your time.
Thank you, Tarina. We also have an announcement from Janet Costa from Spirit.
Hi, my name's Janet Costa, and I'm with Contra Costa Behavioral Health Services Office for Consumer Empowerment, the SPIRIT program, which stands for Service Provider Individualized Recovery Intensive Training. We are a 9-unit college credit course for peers and family members within the behavioral health system for those who have lived experience related to substance use, homelessness, and mental health. Our goal is to train people to become peer and family providers in the behavioral health system. And I would like to announce that our Spirit applications are due on October 15th, which is a week from tomorrow. And the link is posted in the chat. Thank you.
Hey, thank you, Janet, for that announcement. I was not aware of this group here in our own county health services. So thank you for that. Any other announcements? I see Jamie, get your hand up.
Two things. One, actually, Joe Bruno on our council was the valedictorian for last year's Spirit class.
Well, yeah. Oh, okay.
Mark, can you go to the next slide? I don't think anyone from Ensuring Opportunity is here. Okay, just do a quick plug about the Emergency Rental Assistance Program. So they just wanted to make sure that folks knew. I know it's a little hard to see. We'll see if we can attach the flyers too. So with some of the eviction moratoriums ending, they wanted to make sure that community knows that there's eviction support, eviction prevention support. Mark, yes. He just dropped a link in the chat to the fact sheet. And also this flyer has some information if your clients or you or anyone you know are being facing eviction, there's some things that you should know. There's some support. And when you call, there's information about what documents you need to have in order to get some of that rental assistance. That's all I got for that.
Thank you, Jamie. Any other announcements? Any other providers, groups, organizations that have any upcoming activities or programs that you'd like to share? Not seeing any hands or chats. So we are now at our pin it section and just want to list the upcoming meetings and also note that our November Council on Homelessness meeting will land on October 28th, so a little early given schedules. We have a number of other committee meetings, provider meetings, et cetera, which are listed in the last slide of the agenda packet. If there is anything else, Jamie, did you have any other reminders you want to leave us with?
Not that I can think of. Just Homeless Awareness Month is coming up, so stay tuned. You're going to get a bunch of information about events and activities and toolkits and all that. So stay tuned.
Great. Okay. Well, thank you, Joe, for the applause. If there's no other business, I think we are adjourned 10 minutes early, and you can have your 10 minutes back. And have a wonderful rest of your afternoon, everyone. Thank you so much for joining us today.
Thank you. Thank you. Have a good afternoon.
Good afternoon.
Thanks, Lynn. Bye, everybody.
Thanks, everybody. Have a good one.
Bye.